Hello and welcome to the session. It's all about ADPKD. Today I'm excited to be your moderator for this discussion where we'll get an overview of ADPKD, diagnosis, treatment, and management, and advice on speaking to family about the genetic components of this disease. My name is Dr. Chun. I'm a Senior Director in Global Clinical Development in nephrology at Otsuka America Pharmaceutical. Prior to joining Otsuka, I had the pleasure of working in the clinical research and academic sides of nephrology. My previous clinical interests have included home dialysis, preeclampsia, and acute care nephrology. We at Otsuka America Pharmaceutical are proud to be sponsoring today's session on ADPKD and are glad you're here with us. And now I'd like to take a few minutes to introduce the distinguished group of panelists who will be providing us with their expertise and insights regarding ADPKD. I'm joined by Dr. Chris Rusconi and Greta Ellis, who will help us better understand ADPKD and answer some of your questions. Dr. Rusconi serves as the Chief Research Officer of the Polycystic Kidney Disease Foundation, and in this role leads the Foundation's research, education, and advocacy efforts. Additionally, he serves as the principal investigator of the Foundation's ADPKD registry and as a co-director of the Polycystic Kidney Disease Outcomes Consortium. Dr. Rusconi brings over 20 years of private and public biotechnology executive experience to this current role, and with a strong technical background and extensive global pharmaceutical development and regulatory experience. After being diagnosed with ADPKD at the age of 30, Greta spent 13 years as a dialysis patient before receiving her kidney transplant in 2017. We are very thankful to have Greta here to be our patient voice and share her firsthand experience. It's our hope that you'll leave today's discussion with a broad understanding of ADPKD and information to empower your conversations with your medical care team, caregivers, and other family members. If you have any questions or comments throughout our conversation today, feel free to type them into the window next to or below the Facebook live video stream, and we'll try to answer as many as possible. Greta and Dr. Rusconi, if you're ready, let's begin.
Great. So I think first we'll start, I believe we'll have a few slides we put together where we want to share some background about ADPK with you, and then talk about a few, get into a little bit more detail about some of the technical aspects of the disease that we think it's really important for you to understand. So if we start at the highest level of background, is just what is polycystic kidney disease, and it's a genetic type of kidney disease. While it's a rare disease, it does cause about 2% of all cases of kidney failure in the United States. There are two forms of the disease. There's the autosomal dominant form, which you'll hear referred to as ADPKD, and an autosomal recessive form, ARPKD. And of those, ADPKD is the far more common type of PKD, and it is the most common inherited kidney disease in the world. And you'll hear us talk about this probably throughout, and certainly I'll talk about it in a slide or two. But another important thing to understand about ADPKD is it's a chronic progressive disease, which means the disease starts and then over time it develops and progresses. And while it does progress over decades, I think one of the really important messages we want to share with you today is that management of the disease is critical at all stages. So if you understand you have the disease, and you're able to learn and we're able to help you learn about the disease, the patients that have the best outcomes are the ones that have learned how to advocate for themselves. Again, not only when you're approaching kidney failure, but earlier in the disease when there's a lot of healthy kidney, and you can consider lifestyle treatments and other things that will give you the longest life for your kidney. So if we could go to the next slide, getting a little more specific in the background. One of the things that's important, and we'll probably talk about this also throughout, is that even if you have ADPKD, you may not notice symptoms until you're in your 30 to 50 years of range. And that doesn't mean the disease isn't progressing. It just means that the disease hasn't progressed to the point where you're starting to feel the signs and the symptoms of the effects. And while that's true for most people, it is important to note that probably in about 3 to 5% people with PKD start to experience symptoms when they are children. So again, I think the emphasis there is that the D in ADPKD doesn't stand for adult, and it stands for dominant, and the disease can present more rarely as a child and more commonly in the adult stage. Because it's a progressive disease, it's important that if you know PKDs in your family, or if you know that you have PKD, to have your kidney health checked regularly, and particularly if you have a family history, consider whether or not you want to get tested to understand whether you do or don't have the disease. At present, there's no way to prevent PKD, but there are things you can do, and we'll talk about, to keep your kidneys working well. And those include lifestyle choices and diet, exercise, and also available treatments. Some that we'd say, are disease modifying, that deal with the growth of your kidneys, and some that deal with the symptoms of ADPKD, such as blood pressure. And while there isn't currently a cure, there is one disease modifying therapy that's been shown to slow the progression of kidney disease. If we could just flip a little more granular on background on the next slide. And this is something I'll probably hit on at the end, but I think I call to hope that in addition to one approved treatment, there is a pipeline of treatments that are in clinical development. You as patients are a really critical part of seeing those treatments continue to develop. And so I think throughout we'll talk a little bit about the importance in considering participation in clinical trials. It is possible, knowing that this is a progressive kidney disease, that if you're approaching kidney failure, preemptive transplants, meaning a transplant before you reach kidney failure, are possible. But in order to be able to advocate and potentially receive a preemptive transplant, it's really important that you're under a care of a nephrologist before that, for preemptive transplant to be an option, and that option does require a lot of advocacy on behalf of you to potentially receive a living donor transplant. And I think the last thing, which we will definitely also talk about, and Dr. Lamb hit on, is that, ADPKD is a family disease. So if you know you have it, have conversations with your family, one, for awareness that they might also have it, and also importantly, and I'll talk about this in a few slides, family history is really important to understanding how you might experience the disease. And so the way you learn about family history is by having conversations with your family about the disease and how they may be experiencing the disease. And so now in the next few slides, I want to talk about just a few key sort of more technical, clinical and science related topics. So if we could flip to the next slide. And it's a question of what does autosomal dominant mean? Because we use these terms, which are technical terms, and frequently, it may not be clear what that means. And so first, if we just focus on the bullet, we said this is a genetic disease. And so if you have a genetic disease, that usually means that one or more genes is mutated, and that's why you're experiencing the disease. And so in the case of ADPKD, it can be caused most commonly by a mutation in one of two genes, and that is the PKD1 or the PKD2 gene, and certain mutations in those genes cause the disease. In the majority of cases, more than 90%, it is an inherited disease, which means basically one of your parents had the disease, and they passed it along to the child. Although it is possible for a spontaneous mutation to occur, which means the disease is presenting itself in a patient to which there is no family history. I'll talk about what dominant means in a second, but the main takeaway is that as an affected parent has a 50% chance or a 1 in 2 chance of passing the mutation, therefore the disease onto the child. And the disease is equal opportunity, so it affects males and females equally. It affects equally whether across race, ethnicities. It has no biases in that regard. So what does autosomal dominant mean? So if we focus on the diagram on the left, just to walk you through it, you see those sort of vertical rectangles. Those represent chromosomes. We have 23 pairs of them, and we inherit a chromosome from each parent. You'll see a little box that's sort of shaded, in one case in purple and the other case in a lighter color. That represents a gene. Our chromosomes are what carry genes, and basically we have 2 copies of each gene. We have 2 copies of each gene. And so what we say when we mean by dominant is that if there's a mutation in one of those genes, that mutation is the one that basically dominates, or is expressed in how you're, in what we call your phenotype, sort of your characteristic. In the case of PKD, that characteristic is having PKD, so that single gene overrides the information in the other gene. And the important part about that, about the disease being dominant, is it means you only have to inherit one copy of that gene from a parent. So in this diagram here, the father in purple has a mutated copy of one of the PKD genes and has PKD. The mother does not. However, because because it only takes one copy of the gene to cause the disease, in about half of the offspring, you'd expect that mutated form of the gene to be transmitted, and therefore the children would have the disease. And so that's all we mean by dominant. It relates to, you might hear people talk about a recessive disease, which means you have to have two copies of the mutated gene and to have the disease. And so with a dominant disease like ADPKD, it's more easily to transmit from generation to generation. So if we flip to the next slide, this slide is, I think, is really critical in thinking about how to advocate for care and why it's so important to advocate for care. And so if we look at the cartoon, and I'll just walk you through it, the vertical axis is basically just a measurement of how clinicians would measure your kidney function. The higher the number, the more the function; the lower the number, the worse the function. The horizontal axis is just age over time. And the central part of the figure, you see the kidney, and you start out with a kidney that is normal without cysts. And as the disease progresses, the kidneys get more cysts and the cysts get larger and the kidneys grow. And while that we see a big kidney, what the importance or meaning of that big kidney is as those cysts grow, it damages the functional tissue of the kidney, and the amount of kidney left to do the job of the kidney gets less and less over time. So that's just the basics of the cartoon. So what are the lines? So that purple dashed line is an important line. What that's representing on this is how much kidney tissue is left to function. So basically, is it 50% of the kidney, 25% of the kidney, 75% of the kidney? So basically, like how much organ is left to do the job for your body. Now, the other line on this chart is a blue line, and it says EGFR, which is estimated glomerular filtration rate. That's a clinical measure of how well your kidneys are functioning. And the important point in this line is you see those two lines aren't on top of each other. There's a pretty large and important gap there, which we might call a prognostic gap. What it means to you and how to think about care and advocating for yourself is that as the disease is progressing, the kidneys, less and less kidneys available to function. However, if you're just reliant on measurements of kidney function to tell you that, by the time you see a drop in your kidney function by usual clinical measures, a lot of damage has been done to the kidney. And too often what we hear patients say is, my doctor told me to come back when my kidney's not working well anymore. Well, by that point, there's not a lot that can be done for you besides dialysis or kidney transplant. And so the important takeaway from this slide is that it's really important to get within the care of a nephrologist who can use imaging studies, for example, to measure the size of your kidney, because there are tools out there that allow us to understand how the size of the kidney relates to how rapidly progressing is your disease. What's your risk of moving to kidney failure? And that measurement is called total kidney volume. And why that's so important is because this disease is progressing silently. If you don't know what stage your disease is at, or how likely it is to progress and progress rapidly, it puts you at a disadvantage to do a lot of things. You're less informed about your disease management. So if you have this understanding, it'll inform the disease management for yourself and for your physician. That understanding of your risk of rapid progression is really one of the key features in terms of understanding what kind of care you should need. So this information will help promote your advocacy for yourself and your physician's advocacy for your treatment. And finally, importantly, at present, deciding whether someone is appropriate for treatment or not appropriate for treatment is really largely based on, how large is your kidney at the age you're at, and does that mean that you are a candidate for treatment and should consider treatment, or not a candidate for treatment? So again, it's important to not, if you have anybody say come back when your kidneys aren't working as well, know that that's probably not good medical advice, and there's a lot that you can do to understand your disease that will help you be a better advocate and help potentially determine what the best course of strategy is for caring for you and helping keep your kidneys healthy for as long as possible. And so just the last slide before we get to Q&A. So, I think oftentimes we think of ADPKD because it says kidney in it we think of it as only being a kidney disease. And that's in fact not true. ADPKD is a disease that can affect, you know, multiple organs within your body. And we've highlighted in blue here a few of the ones that are really important. So liver cysts are quite common with ADPKD, and in the registry that the foundation runs, we see about 2/3 of patients have liver cysts. In some patients, those liver cysts are don't have a large impact on the way you experience the disease, but in other patients, if there's a lot of liver cysts and the liver gets really big, it has multiple impacts on your outcome. And so it's really important, again, to understand whether you have, if you have liver cysts. And then the other ones, like what's called intracranial aneurysm, which is a problem with the blood vessel in your brain, or the cardiovascular ones, those effects are more rare, but if the disease manifests or affects your body in those parts, it can be really can have really devastating consequences. Those are things that it's really important that you get a good family history on, because while any patient with ADPKD may experience those aspects of the disease, they're more common in patients who have a family history of having those. So that's, again, really important in talking to your family. And then just finally, if I think there's an animation here, so if we just click once, there are also other, other sort of less impactful side effects that are important to note. But I think the two takeaways from this slide are, family history is really important to understanding what your potential, how you may experience the disease. And the other is that, it is we see it primarily or experience it primarily as a kidney disease. So it's important to have specialized nephrology care, but the disease does impact other parts of your body. And so ideally, what an ideal sort of treatment team would look like, it would involve not only a nephrologist who specializes in PKD, but it would also involve other doctors who are experts in diseases of these other organs. And so, a care team for an ADPK patient is much broader than just the nephrologist. It might include a doctor who specializes in the liver, a doctor who focuses on, the brain, the heart, et cetera. And so as you're seeking out care, the foundation has resources and other groups have resources to speak to what should your care team look like, and so that you can, again, advocate for the best care that you can find. And so that, I think, is the end of the slide portion, I believe. And so Dr. Lamb, I think it's back to you for question and answer.
Thank you, Dr. Rusconi, for that great overview of ADPKD. If you're just joining us, thank you for being here and being part of Kidney Action Week. Our current session is all about ADPKD. Please join the conversation by typing questions and comments into the window next to or below the Facebook live video stream, and we'll try to answer as many as possible. We've already started to get some questions from our viewers. We'll start answering them in just a moment. Greta, we are so glad to have you here representing the voice of the ADPKD patient. Can you tell us a little bit about your journey with ADPKD?
Sure, I can. Thank you first for allowing me to be a part of this panel to discuss ADPKD. First of all, I was diagnosed with PKD at the age of 30. I knew PKD was in my bloodline. However, because my father died at the age of 39, he had an aneurysm. And at that time, we did not know that he had PKD. And I'm not even quite sure if he knew. No doctor told him that that was his problem as a young child. I only knew that he had uncontrolled blood pressure. And I knew my mom used to talk about that all the time. And he did present with the large PKD belly. But at the time as a kid, I thought he was just a big man, So once he passed away, after his autopsy was performed, my mom sat me, I had 4 sisters, sat us all down at the time and explained to us that there was PKD, and she didn't know a lot about it, but she was like, "You girls are smart. I'm sure you guys will start." And I did. At the age of 13, I was 13 when my dad passed away. I started my own research, trying to find what it was and what it was about. So as growing up, I kind of put it in the back of my mind and never really focused on it a lot growing up through high school and college. But after I married and had my first kid, I kind of knew that I was getting close to 30. And I knew from all the books that was said it was when I would start having problems. And I was almost to the day of my 30th birthday is when I started having problems. I presented with recurring kidney infections, UTIs, extreme flank pain. My blood pressure had started to really go up during my pregnancy. But after I had my son, it was still kind of uncontrollable. And I was on different kind of medicines. I think at the most I was on, I think only 2 meds at the most at one time. And so from that moment on, I found me a nephrologist and started watching my kidney function. And I did pretty good for quite a while until I turned 39, which was the age that my father died. And I was thinking, they talked to me about dialysis, and I was like, I wasn't scared because I'd done all my research and I knew what was going to happen. And I was like, sure, because I knew my dad had passed away at this age and I was ready to fight. So I was on dialysis for 13 years. And along this journey on dialysis, I started dialysis in 2005. And in 2008, I had both of my kidneys removed. I had a bilateral nephrectomy. My kidneys had grown so large that it was impacting my daily living. I couldn't sleep well. My mobility was really, really bad. And I decided with my nephrologist that it would be the best thing for me at that time. So I had both of my kidneys removed, and I felt so much better after I recuperated. My mobility was up. I was breathing better. I could sleep at night. And I was just overall, satisfied with the result. And just to give you an idea how big my kidneys were, both of my kidneys combined weight was 35 pounds. So the kidneys had grown awfully large and full of cysts and fluid. So I continued on dialysis, and I became a candidate for the transplant list. I was required to lose some weight because I had gained a lot of weight with my 2 of my pregnancies, both of my boys. And I had to lose a lot of weight to be a candidate, which I did. And I got on the list, and I was transplanted in 2017. I received a deceased donor, which is doing great for me. My kidney function, it's not as high as, some, but I'm working hard. I watch my diet. I watch what I eat. I exercise every day. I try to keep my weight down. I've lost more weight. My total weight loss since I started dialysis till to now has been 145 pounds, 147 pounds, something like that. So, I've really been working hard to keep my kidney, trying to eat right, watch my intake of phosphorus and potassium, and I'm following the care of my nephrologist, doing exactly, what I can to keep the kidney healthy. And I'm still, even though my kidneys are gone, I'm still a PKD patient because like Dr. Rusconi was saying earlier, we can still have problems with aneurysms and things like that. So I am screened annually for aneurysm since my dad had an aneurysm and I had a sister that had an aneurysm. So it's something that I'm watching too. So even though I'm off dialysis and I have a transplant, you're still a PKD patient always. And it just gives me the drive to advocate, to let people know that you can, our disease is not curable, but you can manage your symptoms, and, you can still live a healthy, lifestyle if you want it. Thank you, guys.
Thank you, Greta, for sharing your inspiring and empowering story.
You're welcome.
Let's go to your questions. I encourage you to join the conversation by typing questions and comments into the window next to or below the Facebook live video stream. We'll try to answer as many as possible. And let's go to the first question for Greta. What tips do you have for starting the conversation with your family?
I think it's very important to, I'm going to speak for myself in the African American culture. We as a group are not real letting you know what's going on, when it comes to, your bloodline, or if anything is there that may cause you symptoms later. Like I said, my dad, he was 39 and was only being treated for his blood pressure. So once, my dad had found out that he had PKD, but after he passed away, he had a brother that went and got tested, and two other sisters that got tested who also had PKD.
Mm-hmm.
And, my mom was real, open with us about it. So my kids have been there along my journey. And so I never hid anything from them. And I told them exactly, this is what it is, and this is what could happen. And, if you start presenting with these type of problems, this is going to be your journey, but, you make your journey. And so, like with other people within my family, we're all really close, and we always, comment and talk to each other and let each know what each other is going through. So I just think as a family unit, you'll have to be open with each other, let everybody know what's going on. And, just like you pass along, other things within your family, you're going to pass along this PKD, and it's going to be there. So they just be open and keep the communication lines open. And it's not hard if you're sharing it with your kids and letting them know. And if you don't have PKD and it's in your bloodline, you still should talk, sit down and talk, with other members of your family to let them know it's not a hard conversation to start. Don't be afraid is the main thing. Don't be afraid.
Great, thank you, Greta. The next question is for Dr. Rusconi. What are some of the symptoms of ADPKD?
Great. And first, I want to say thank you so much, Greta, for sharing your story. In fact, I think you've really highlighted a lot of what I'm just going to say really quickly. I think one is, and this isn't a symptom, but understanding your family history is really important because, for one, like many other kidney diseases, the symptoms may not show up early. And two, some of the symptoms are kind of general. And so if you know your family history, it can really help frame the response to what I'm going to share. So I think, Greta talked about this. One is back belly and side pain. So as the kidneys grow, disease progresses, pain is a very frequent complication, and certainly pain localized sort of in the abdomen, belly, and back area is one symptom that's important to be aware of. A second one is blood in the urine. So we talk about cysts growing and getting bigger, but cysts can also rupture, which in addition to being quite painful, can also sometimes lead to blood in the urine. So blood in the urine would be a potential symptom of ADPKD, particularly if you have a family history. And then the final one, which I think Greta highlighted in both her experience and her father's experience, is high blood pressure. And so high blood pressure is a very common early symptom of ADPKD, not only in adults and in children. So those are really, family history plus those three things are really important to be aware of.
Thank you. The next question is for Greta. Greta, you have a kidney transplant. Congratulations on the kidney transplant. The question is, what tips do you have for protecting the health of your transplant as an ADPKD patient?
Oh, it's very important to limit your contact with people who, well, it's COVID now, but I remember when I had my transplant in 2017, I was like wearing a mask, avoiding a lot of people, a lot of crowded situations, movie theaters and things like that. But now since masks are common day and we're wearing them everywhere. So now protect yourself, wear your mask, um, avoid, people that may be sick and things like that. Those are, ways to avoid, getting anything infectious in the air. But you also need to be mindful of the foods you eat to protect your kidney. You want to get plenty of exercise, keep your body healthy and strong, so you'll be able to fight anything that may come across because you're going to be taking tons of immunosuppressives and your immune system is going to be very low. But that doesn't mean, that you're not still going to be, you can still be a strong individual. So you have to protect yourself in those ways, far as wearing a mask and, being aware of the people you're around, your surroundings, and eating healthy, taking your meds. My goodness, take your meds always on time, every 12 hours, take your meds. And then your kidney function, it's going to, I've had ups and downs with my kidney function, but I mean, just keep taking your meds and, keep your body healthy and strong as you can, which, comes from nutrition and exercise. And your kidney is going to last you, longer, if you take care of it than if you don't do anything else.
Thanks, Greta, for that great advice on kidney transplant health, much of which applies to, I think, many people, most people.
Right.
The next question is for Dr. Rusconi. The question is, I had an ultrasound and they found a cyst on one of my kidneys. Does that mean I have PKD?
That is an excellent question. So I'll start by saying, of course, we're not giving out medical advice in any question about your health. You should obviously talk to a doctor, but a single cyst is really common in adults as we age, and so it doesn't mean that you have ADPKD. In fact, I think about half of people over the age of 50 have a single cyst. You would expect to find a single cyst on a kidney in an ultrasound, and so it comes back to that wouldn't be the case, and it comes back to family history is really important because again only a few cases are spontaneous. So when you get that ultrasound, understanding your family history is important. And I think the other piece related to that is there are well-defined diagnostic guidelines about cyst number and kidneys. And in ADPKD, I think you've heard Greta talk about her kidneys. It's a disease that affects both kidneys. Generally, cysts are present not in one kidney but in both kidneys, and they're numerous. And so no, a single cyst wouldn't be a sign of ADPKD. You of course talk to your doctor, but family history and typically cysts in both kidneys and multiple cysts in both kidneys would be more indicative of ADPKD.
Thanks, Dr. Rusconi. Next question also goes to you. If I have ADPKD, should I have my children tested?
Wow, so that is a loaded question, and I probably Greta's input on this would be very, I think, informative. But I say this is a really personal family decision. The one resource that I could point people to is, we did, and we have a magazine called PKD Life, and in our winter 2020 issue, which you can find at pkdcure.org/PKD Life, had a couple of families discuss their decision making around the pros and cons of testing. So I think you could get that sort of viewpoint from other patients and families. But there's obviously some pros and there's some cons. So some of the pros are certainly testing is positive and motivation to monitor kids' health. If the test turns out to be negative, it could certainly be anxiety relieving to know that the child doesn't have the disease. And it's possible that it could be promote healthy habits. If you know you have the disease, maybe there's more motivation to engage in the kinds of behaviors and things that Greta shared that she practices. But there are also cons. So certainly the kinds of testing involved, which are generally either imaging tests or genetic tests, can be expensive. While in the current sort of healthcare legislation, being diagnosed doesn't impact one's access to health insurance, it can impact one's access to other forms of insurance, for example, such as life insurance. I think a lot of families discuss the question of a child's autonomy to know about their disease on their own, to let them have the agency to take that decision. And then, the sort of the opposite of, having a negative result, finding out you don't have disease, being anxiety relieving. Well, if you're diagnosed and if you tested and it's positive, well, that certainly can be anxiety creating. So again, those are some of the pros and some of the cons. I think that article I referenced is a great resource, but it's very much a very personal family decision.
Thank you. The next question is for both of you. I am an ADPKD patient and am looking to meet others who have gone through this. Any suggestions on where I can find them? Maybe we can start with you, Greta.
Oh, yes. When you said that, I was like, yes. There's all kind of resources out there for ADPKD patients. I live in San Antonio, Texas, and now I'm going to promote my chapter. We have the San Antonio PKD chapter, and we're a real close-knit community here, and we have all kind of activities. We have a walk every year to raise funds and to fundraise for PKD. You can always reach out to your local community, maybe just Google Walk for PKD or PKD chapter and put your hometown and see what pops up. If not there, there's always the National PKD Foundation, which is in Kansas City. And they're a great, great resource for finding out, how to live with PKD. And there's always webinars and meetings, and you can get emails, and there's just so much there if you're looking to learn more about ADPKD. And there's lots of community support. And once you find a group, just get right in there and volunteer. You'll meet more people, like you that have PKD. Because when I first moved to San Antonio, almost 20 years ago, I didn't know anybody with PKD other than the ones that were in my family. So that was the first thing I did. I Googled, PKD community support, and then I found this chapter. So we're out there, waiting and willing to help you, join this community and learn more about PKD. Thank you.
And Dr. Rusconi.
Oh, sure. I can try to add to that, but I think Greta is a very powerful social media coordinator, so she's got a lot more to say and experience in doing that than I do. But just to sort of tag off of what she said, there's a lot of ways to get involved with the foundation, and so probably the easiest way to find out what we're doing and to find out how to get involved and how to engage with us on social media and other activities is go to our website, pkdcure.org. And up in the top right-hand corner, you'll find access to nearly everything you need, how to stay connected, social media links. You can sign up for our newsletter, find ways to get involved as a volunteer, find, as Greta mentioned, find chapters in your local community to participate in. And then the walk, although this year it's virtual, it's still a great way to be connected. And that walk for PKD this year is coming up in just a few weeks. It's October 8th through 17th. That'll bring together more than 10,000 walkers, more than 1,000 teams, tons of organizations across the country. So again, it's a great way to, start to connect with the foundation, and then through the foundation, connect with people in your local community or connect with people nationally. So, thank you.
Thanks for all those great resources. There's a question from Ed for Dr. Rusconi. Can ADPKD skip one or a few generations?
That's a fabulous question, and I think there can be confusion about that. And the straightforward answer is no. It doesn't skip generations because it's a dominant disease. If you have to inherit the gene from one of your parents to have the disease, and then if you have, the only way to transmit it to the next generation is for one of the parents to have the disease and to sort of pass that gene along. And I think there's probably confusion because, again, in some cases, the way ADPKD presents in a family can be really varied. It can be really severe, and it would be obvious the person knows the disease, knows they have the disease, but it can also progress very slowly. And so it might appear that a person doesn't have the disease because they happen to be a person who's while they have ADPKD, they're fortunate that they might not have symptoms until their 60s or 70s. So it can appear that they don't have the disease, but somebody in the family has to have the disease to pass it along if it's in your family. And only rarely will the disease show up sort of spontaneously, meaning there's no family history. But that was a great question, and I hope that answers your question.
The next question comes from Mike for Dr. Rusconi. What are the complications of PKD?
There are a lot of complications of PKD. So, I think Greta hit on some of them. Some of the key complications are still kidney related, and those would be urinary tract infections or urinary tract infections. So the appearance of pain, microbes, urine. So that's very common. Kidney stones are also a very common and very painful and very important complication. And I think, Greta is a fabulous resource. And when she's talking about things like reduced phosphate in the diet and other Karen dietary, and what part of what she's talking about is there are things you can do nutritionally that will reduce your risk of kidney stones. And of course, drinking a lot of water reduces your risk of kidney stones. But those are the main sort of kidney complications. And then there's the other ones that we touched on that are complications and part of the disease, like liver cysts, like some of the other things that Greta shared, like aneurysms and those types of things. Great question, Mike.
Thanks. There's a two-part question for Greta. Where did you go for research? I think research here means personal research on the disease. And second, were doctors a good resource for you, or did you go elsewhere?
Initially, great question. Initially, I started my own research. Back then, I went to the library, picked out books on kidney disease and anything with kidney function. And to be honest, the first time I heard about PKD, there was a family on a talk show. I can't remember what talk show it was, but they were talking about PKD. And I was like, oh, I can't believe it, because I hadn't heard of anybody else speak, personally on PKD. Only things that I was, pulling up medical books and things that I was reading on my own. But then when I started to go to the doctor, for the second part of your question, when I first started to go to the doctor, my husband is military. And so the first doctors I began to see were military doctors, which not knocking military doctors, you guys, but they had no clue of what I was talking about. It was like every time I went to the doctor, I was educating the doctor on PKD, and he was, go, okay, but then once I started looking outside in the civilian world, once, I knew my kidney function, I was having trouble with my blood pressures, which they were only prescribing me medications, but I knew it was something deeper. But there I was able to find nephrologists that specialized in the care of PKD patients. So initially, I, just did research on my own, reading lots of books, anything that I could find, pamphlets or anything like that I could find about PKD, I was reading them. And then once I got under a nephrologist care, once I found a great nephrologist that knew, specialized in PKD, that helped a lot, because they were able, to really handle my disease and make everything easier for my day-to-day functions. Thank you, though, for that question.
Thanks. That's really interesting that it was on a talk show. It kind of makes me
I
think
wish
that
I
maybe
could remember the name of the talk show, but it was so many years ago. But there was a family, and I couldn't believe it. And I was like, so there are people out here with PKD. So
maybe more talk shows should do that as a public health service. The next question comes from Carolyn for Dr. Rusconi. What is the size of normal kidneys compared to how big they can get with ADPKD and affect you like Greta described?
Yeah, so think of a normal sized kidney is about the size of your fist, and so maybe it's half a pound to pound. And what Greta's discussing is a kidney that's the size of it's football season and I'm in Kansas City, the size of an NFL regulation football. And so just, that's a 10, 20 times bigger than what a normal non-ADP kidney would be. So they're substantially larger. And I think, the story Greta shared with how the size of her kidneys impacted her overall health and quality of life, I think, says more than I can say about sort of how big does a kidney get and what's the impact of that size on how a patient's experiencing life. So, but hopefully that answers Carolyn's question.
Thanks. And the next question is for Greta. How often do you see your doctor or doctors about PKD? Does it require regular checkups?
Of course, especially if depends on your kidney function. If your kidney function is higher and you're doing well, you may not see your doctor maybe once a year to every 6 months. But as your progression, starts to decline, your kidney function, of course, you're going to see the doctor regularly, up until, because they're watching your kidney function, to see when's the best time for you to, for there to be an intervention, whether it be, a preemptive transplant like the doctor talked about, or starting dialysis. But as a dialysis patient, you're going to see the doctor once a week in clinic. But before PKD takes your kidneys that far, I would, suggest that if you're doing well, still see your doctor every year. If your kidney function is starting to decline, maybe he'll tell you every 6 months. Once you go to the initial visit, and the doctor be more inclined to let you know how often he needs to see you to watch your progression. But I think just like your annuals, I would treat it as an annual for any other. We all get an annual, checkup, or as ladies, we get our annuals, mammograms, and things like that. If PKD is in your family, I would suggest that once a year you do that too.
Great advice, thanks. Ed on Facebook is asking Dr. Rusconi, my family had 4 generations of ADPKD, but seems to have stopped with me. Can it show up again? Should people do genetic testing before having children?
Ed is asking great questions, and again, that's a very personal question. Yeah, I think in Ed's case, though, there's probably 2 ways to understand whether, I don't know if Ed's diagnosed or not, but obviously there's 2 ways to find out. One would be imaging to understand whether whether there are cysts in kidneys that are consistent with having ADPKD, and the other is genetic testing to determine whether or not there is a mutation in PKD1 or PKD2. The answer to the question of, again, genetic testing before having children, that is a very personal decision. Obviously, the technologies exist that would allow for one to be tested to determine if you do have the disease. I'd say the only caveat to genetic testing is, like every aspect of PKD, the genes that cause the disease are very complicated, and so it's important that the testing be done by a reputable company who are good at the test, because it can be difficult to identify at times mutations. It's in some people mutations in the PKD genes, and there are some cases in which the disease is not caused by PKD1 or PKD2, so it's possible to miss. But yeah, again, great questions and very personal choice. But the important thing is, I think maybe the important end to this answer is the technology and the availability of tests do exist. And so if one wanted to go get tested before having children, that is a very viable option.
And another question for Dr. Rusconi: do the cysts come back after a transplant, and how fast if they do?
No, that's again an excellent question. I think so. I'd answer it in 2 ways. One, when you just think about the kidneys and the cysts. So in the process of receiving a transplant, the donor, whether it's a living donor or deceased donor, that organ or the person will be thoroughly tested to know that they do not have ADPKD, and so that the kidneys that are being transplanted into you are free of ADPKD. So the answer is no, those kidneys will not develop cysts because the process of undergoing the transplant rules out um, the kidney coming from a patient with ADPKD. Now, that being said, I think the point Greta made is excellent, which is, yes, after you receive a transplant, your kidneys, the new kidneys are healthy kidneys and won't have disease. However, the disease can impact you in other ways, whether it's your liver or concerns about aneurysms or other things. And in most patients, the diseased kidneys are not removed at the time a kidney is transplanted, and so there may still be ongoing pain and other complications associated with the cystic kidneys that would be remaining in most cases. But great question.
Thank you. The next question is for Greta. People are often worried about talking to their family members after getting diagnosed. What suggestions do you give people you work with in your advocacy?
I just tell them education is key, I think. And the more you know about a subject, the easier it is for you to comprehend it, to relate to it, to receive it. So I would go forth with hit them with as much information as you can, get pamphlets, tag them to webinars or, things like this today. I'm sure that's being recorded and refer people back to things like this. And as a family, I think everybody's family is like mine. I'm sure that's not true, but we're all very close knit. And I guess we've all dealt with PKD in some kind of way through the years, but our knowledge of PKD is short. My dad was the first person I knew to have PKD. Not saying PKD, of course, is in my bloodline going way back. So, but I never knew my grandfather on my dad's side, and I never knew my great-grandfather on my dad's side. So needless to say, those two generations probably passed away from PKD because they all died early. So I think it's imperative that, just sit down with your family if they're concerned, if they're afraid, and give them the information. And I myself, I just try to be a living example of PKD for my family. I feel like if I can do the best that I can, they can look at me and be inspired and maybe, go into the situation with a good head and know exactly what to expect.
Thanks. For Dr. Rusconi, is it common for those cysts in ADPKD to become cancerous?
Oh, excellent question. And I think that's a really great question. And the answer to that is no. So when we think about cysts in the kidney, they're not, well, I think simple answer is no, they're not the kind of cysts that would develop into a tumor or be a cancer. But I can understand the basis of that question because cysts grow. It's a disease of sort of excess growth of tissue within an organ. So I can see where that question comes from, but no, the answer to that is no.
Dr. Rusconi, I have enlarged kidneys with cysts, but no family history. My two sisters are in her 70s with no symptoms. Should I get tested?
Again, I'm not so start the caveat of you should talk to your doctor is the first thing, because obviously that's where medical advice comes from. I think again that's a personal question. About 10% or a little less than 10% of cases have no family history. They are spontaneous, and that means that the mutation that caused the disease arose as you were being sort of conceived and born. So it is possible to have ADPKD without a family history. And if that's, it's I think Greta's made a number of excellent points about the more you know, the better you can take care of yourself and the more you can advocate for yourself. So one could see a good reason to get tested in the absence of family history if you have symptoms or presentation, consistent with the disease, such as cysts on both your kidneys.
Next question is for Dr. Rusconi. If you have PKD, do you have to follow a different diet compared to other kidney diseases?
That's an excellent question, and there's a growing number of dietary resources. And I would think so. The short answer is, uh, you know, the diet for patients with chronic kidney disease is not really related to necessarily the appropriate diet is not necessarily related to why you have the chronic kidney disease. And so in general, kidney healthy diets are kidney healthy diets, regardless of why you have chronic kidney disease. I think the important things to think about diets are the kind of diet that's appropriate and right for you is going to be dependent on the stage of your chronic kidney disease. What's an appropriate and healthy diet when you're in the early stages of disease, what people might call CKD stage 1, is different than when you're at CKD stage 3 and 4. And then I think, though, the other thing to think about is going back to the question of complications of disease, and that is that kidney stones are quite common in ADPKD, and so that might lead to a more restrictive or different dietary considerations than someone would have if they had a kidney disease that didn't have a high rate of complications of kidney stones. And so I think the general answer is a kidney-friendly diet is appropriate, regardless of the basis of your chronic kidney disease. But there are some special considerations related to things like kidney stones and aspects of PKD that might make you be more attentive to what you eat.
Thanks. And the last question for Dr. Rusconi, you mentioned PKD affecting other organs. Do you have to see individual doctors if you have PKD to test out your other organs?
That's, again, a fabulous question. And, there's a lot of discussion on going into what a care team looks like and how best to navigate care for patients. I'd say generally, you start with your nephrologist. If you have a really good PKD nephrologist, they're aware of the other complications. And as they do a workup and understand your disease, they are, again, PKD specialists are very good at evaluating where you are, what your family history is, do you have signs and symptoms that other organ systems might be involved, and then make a referral to the appropriate specialist. I think the entry point is always a nephrologist, and much preferably a nephrologist who has a high level of expertise in caring for patients with PKD.
Thank you. It's been a great discussion and great questions. Before we wrap up, I'd like to give each of our panelists a moment to share their final thoughts. What's the main takeaway you want kidney patients to know about ADPKD? Greta, let me start with you.
I just want everyone to understand that PKD is manageable. You can come out good on the other side of it. It's a family thing. You live with it. You can grow with it. Just educate yourself and your family. And if you have questions, find a great chapter, a great foundation to work with, and you'll be great.
And Dr. Rusconi?
Yeah, two things really quick. So I think one thing is, there's a lot of reason to be hopeful about treatments. There's currently one approved treatment, and there's a growing pipeline. And one of the things you as patients can do to help accelerate that is, if you're interested and willing, participate in clinical studies. We have a Find a Clinical Study site on our website. It's clinicalstudies.pkdcure.org/questions. That can help you identify if you're appropriate for a clinical study. If you sign up for our registry, you're participating in clinical research. We also have tools within the registry to help you identify clinical trials that might be right for you. And again, that's something you can do to help accelerate the development of therapies. And then last point is, you all deserve really great care. And so we have a resource on our website, pkdcure.org/find-a-clinic. If you don't think you're getting good care, that's a place where you can go as a resource and see if there are PKD specialists near you and see what services they offer, so that if you're not getting the care that you deserve, you can maybe find a nephrologist who has the expertise you need, because you all deserve excellent care.
Great. And I'll say a few words for my part. This conversation was a great reminder about how much we still have to learn scientifically, personally. Every time I hear a patient's story, I learn something new. And it's really gratifying. It has been really gratifying to see a patient who really advocates for herself and takes control. Makes a huge difference. Dr. Rusconi and Greta, thank you very, very much for spending this time with us today to provide your perspectives. There's really so much to talk about when it comes to preventing and understanding kidney disease. We can't wait to bring you back for more chats in the future. Thank you to everyone at home and at work for joining us online. Also, we'd like to thank the sponsor, Otsuka. We're happy to have sponsored this great session today on ADPKD. If you aren't already following, please follow kidneyfund.org on Facebook or send an email to kidneyfund.org, and you'll be the first to know about other resources like this. Another resource I'd like to share is ADPKD Questions. It's really adpkdquestions.com, all your questions about ADPKD. Also, make sure to check out the agenda for the rest of the Kidney Action Week. Our next session is coming up at 3 p.m. Eastern Standard, 12 p.m. Pacific Time, and it will be about the kidney transplant process and what you need to know. Thank you.